Let's go live now to Dr. John Dombrowski, the CEO at the Washington Pain Center. Thank you for joining us on the program. Now, President Biden has pledged 100 million people will get the jab during his first 100 days in office. How likely is he to hit that goal?
I think his own administration and Anthony Fauci, Dr. Fauci, said they're not going to make it. It's going to be about 63 million, and that's about as best they can do. What you're seeing now are, one thing to get elected, with political promises, but then there's another thing to actually. So he's not going to make it.
The head of the Centers for Disease Control and Prevention has admitted the government doesn't know how much vaccine is available. How concerning is that?
Well, that is a real disconnection between the government, which is obviously ultimately responsible, and the suppliers such as Pfizer, Moderna, and other pharmaceutical industry. They should really be working hand in glove with respect to this pandemic that we have across the planet. How many people really need this vaccine? And obviously, we need to be doing triage. It's great to have everyone in America to get this, but we should always focus on the elderly and the sick and those people who are more at risk for dying of this virus than everyone else. We need a triage because there's a limited supply.
We've seen how several state governors are highlighting vaccine shortages. How might that affect the rollout? Is it going to be a lottery depending on where you live in the U.S.?
I think it goes back to my first point in terms of not necessarily a lottery, but more importantly, who needs it the most? In medicine, we always do this. If you're young and healthy, you're not going to get medical care right now because you'll make it. If you're old and sick, you go to the front of the line. And we've done this on the battlefield, anywhere in medicine. In terms of the emergency room, we take people who are sicker first, and people with colds and things like you'll wait. Same thing for this in this terms of a rollout. But the good news is we now have supply chains such as Amazon, who is now all of a sudden wants to help this administration out in terms of getting product placement, which is also which would be positive, I think.
Yeah, the Biden administration is accusing its predecessor of a chaotic vaccine rollout. Is that entirely the case, do you think?
Well, I'm not so sure. I guess there are always political points to be waged or to won, but this is science, and these are patients' lives, and small, cheap stops like that I don't think are very helpful. I think what we need to do is, okay, let's focus on what the problem is now in terms of getting the supplier of these vaccines, supply chain working out, and patients who need to go first, go first. So that's nice to do a cheap shot, but I think it's more importantly, what are we going to do today and tomorrow?
Yeah, the new administration is saying it just suffered a lack of information during the transition of power. How much of that is to blame, and how much has the unseemly political dogfights over the past month or so affected the vaccine program, do you think?
I think we have it right exactly. It's this political dogfight. There are real points to be, one, you're in office now. Let's man up and manage this problem that we have. And again, it's working with supply chain, the suppliers. Where's the greatest need? Where's the elderly populations? Where are the sickest among us? Let them go first, and then we'll roll it out as we go on down the population line. Again, this is triage, and I think it's a smart way to move forward.
Dr. John Dombrowski, the CEO of the Washington Pain Center, thank you very much for your time.
Thanks.